Well, hello everyone. I'm Bob Ravenscroft, Vice President here at Bryan Health and Chief Development Officer. And what a privilege it is. We're sitting in really the birthplace of Bryan, and we're introducing to you the next President and CEO of Bryan Medical Center, Eric Moss. Welcome, Eric.
Thank you, Bob.
So what we're going to do is take you through kind of a three-part series, and one of them will be just getting to know Eric a little bit. Then we're going to learn a little bit more about what he did before he got to Bryan, what you've accomplished since you've been here. And then our third segment is going to kind of focus on Eric's vision for the future of Bryan Medical Center. So sit back and enjoy. We're going to get right into the first one. So Eric, could you tell me a little bit about your early life and how maybe it led you to a career in medicine?
Sure. Yeah. I think where I'll start is to tell you about my dad and his story. My dad is from India. He's from the southwestern tip of India in a state called Kerala. And he came to the United States to study medicine, to be a physician. And before that, though, it's important to know my dad's dad was a physician, his dad's dad was a physician, et cetera, et cetera. And our last name actually is pronounced Moose in India, where my dad is from. But Moose means physician of the king. And so my dad's family were physicians for the people of that area of southwest India. Growing up in Omaha, my goal was always to be in healthcare, really, frankly, to be a doctor and carry on the legacy of my family. Went to Creighton University to study undergrad and to be pre-med, and probably like a lot of people, got into sciences and just didn't really quite find that was that I was naturally good at. Meanwhile, I was starting to get involved in some extracurricular activities like student government and leadership and other things, and stumbled, frankly, upon healthcare administration as a career path. And started taking some classes, and it just completely fell into place. It was just very clear that that was something that what I was supposed to be doing.
So what did your dad, a physician, think when you said you wanted to be a healthcare administrator?
Well, he wasn't very happy with me, actually. And a lot of people say, well, you stay in healthcare. And for a while, I would say my dad didn't really talk to me kind of in a joking sort of way. But yeah, that was, the son of an Indian parents. That was a little bit of a disappointment. Since that time, my parents have been incredibly supportive, and I know they're very proud of my career. But yeah, it was it took them aback to not kind of follow in the family legacy.
Eric, one thing I think is maybe you have an interesting perspective on is we see the demographics of our state changing, and you come from a mixed race background, and our community and our state's becoming more diverse. What perspectives can you lend from your past and your background, and how that feeds into how you think we should shape our workforce?
Yeah, well, I would say to a degree that opportunity to be reflective of our community is important, and you're right, the demographics of the community are changing. That what the world, or what even Lincoln, Nebraska will look like in 10 years from now is going to look far different than it does today. And we've got to be prepared as it relates to how we care for increasing populations of diverse patients, as well as what our workforce looks like over the course of the next decade as well.
Yeah, and it's something that you can't just flip your workforce immediately, and frankly, our workforce is pretty reflective of the bulk of our patients now. But I think you've been doing some interesting work that a lot of people don't know about in this arena. Can you talk a little bit about some of the relationships you're forming with the historical Black colleges and universities and some other organizations in the community?
Sure. Well, as you know well, one of our driving strategies here at Bryan is around health equity and ensuring that all patients in our community have a chance to live healthy lives. And one of the many components of that is ensuring that our providers are reflective of our broader community. And so what we found is we have a diverse mix of providers, but they don't necessarily align to specific patient populations that exist in our community, specifically around African American providers or providers of the Latinx community or providers of the Southeast Asian community. And so we've been really trying to build relationships, make inroads with the opportunity to be intentional around our recruitment efforts. And so whether that's being targeted in our recruitment or building relationships with key community leaders or building relationships with key programs at, say, University of Nebraska or other places, all of those are bearing fruit in terms of building inroads to attract and recruit providers of underrepresented minorities.
I think our workforce would like to learn a little bit more about you and your family. Can you tell us about your family a little bit? Are you comfortable doing that?
Absolutely. Yeah, happy to. And it's easy to talk about family, I think. So I met my wife, Becky, when we were studying at Creighton. She is also from the Omaha area. She actually went to Bennington for high school, and she's a social worker with her undergrad. Then we met, got married, and graduated Creighton, moved to Iowa City for graduate school. She studied school counseling while I studied healthcare administration. She now stays at home, but again, is a guidance counselor by background, working as an academic advisor. We have 3 kids then, a 15-year-old son, Ben, who's a freshman, 13-year-old daughter, Leah, who's in 7th grade, and then an 8-year-old son, John, who's in 2nd grade. One of the driving forces for us to actually come to Lincoln and be close to our family, come back home to Nebraska, was we were in the process of adopting our youngest son, John, from China, and we actually had the chance to move to Lincoln before we were matched with John, and so shortly after we moved, we were able to travel, and I've just been really fortunate to be in Lincoln.
Well, what do you guys like to do to unwind as a family? Because this is an all-encompassing job, very, intensive of your time and of your intellect and everything. So when you do get a release with your family, what are some of the things you like to do?
What I would say is we'd like to do a lot of things families like to do in Lincoln. Spend time, go to dinner, eat together, whether that's at home or trying out the various restaurant scenes in Lincoln. We love to watch sports together, so a lot of kids' activities, as you can attest to, Bob, with your daughters. And then, when we have time together, we love to travel. So one of the things we've just been fortunate to do together as a family is travel to a lot of different places. I think what I found is, the work can be intense, and even with our kids' school activities, you feel like you're running constantly. And so what I found is, in order for us to spend concentrated time together, that the opportunity to go places and just be together in a more intentional environment has been really good for our family dynamic.
Thanks for sharing some of that personal stuff.
Yeah, absolutely.
So again, we're going to have a 3-part series. So when we're back next week with this pre-recorded session, we're going to focus a little bit on what Eric accomplished before we got to Bryan and some of his accomplishments here at Bryan. So thanks a lot, Eric.
Thank you, Bob.